I mean, one of the interesting things about living in Northwest Washington, we have to be perhaps more self-reliant. There's only one hospital in this community. And it's a community that has a long history of solving problems together.
On July 2, 2003, Vancouver, British Columbia won the bid to become the host city for the Winter Olympics in February 2010. This event was expected to draw 1.8 million visitors from 80 countries, involve almost 6,000 athletes, and require an additional 35,000 support personnel. Given the proximity of Vancouver, British Columbia to Whatcom County, Washington, Governor Christine Gregoire convened the 2010 Olympic Security Planning Committee. In light of incidents such as September 11th and Hurricane Katrina, the task of the Security Committee was to identify and address the potential risks and impacts that may be associated with an international event of this magnitude. This required developing the plans, response capabilities, and most importantly, the organizational relationships necessary to mitigate those risks. This initiative provided the emergency response community in Whatcom County and Washington State the opportunity to further develop its response capabilities. This effort would be built upon established relationships between agencies at the local, state, and federal level, which existed as a result of previous national level exercises and large-scale incident responses conducted in Whatcom County. There are a number of unique challenges local emergency managers in Whatcom County consider. Interstate 5 is the single major north-south transportation corridor through the county.
We've got the San Juans, we've got the water on one side, the mountains on the other. We don't have quick access to regional resources that we could quickly come to bear on a disaster situation. And so we're somewwhat self-reliant.
Peace Health St. Joseph Medical Center is the only hospital serving Whatcom County's population of nearly 200,000. Severe winter storms and flooding are not uncommon in this area during the January through February timeframe. Interstate 5 can be significantly impacted by these winter weather incidents. Planners needed to also consider the additional threats generated by an event of this nature, such as a mass casualty incident resulting from the collapse of a venue, an earthquake, or transportation incident. Public health issues common to mass gatherings, such as foodborne illness, seasonal influenza, or norovirus, or an intentional event, such as terrorism. Planning for large-scale mass gathering events has typically focused on law enforcement and security issues. However, recent incidents like Hurricane Katrina have demonstrated the critical role public health and medical preparedness play in an effective incident response.
Public health in general has not been one of the traditional players at the table when it comes to emergency management or emergency preparedness.
Through the advocacy of Mary Selecki, the 2010 Security Committee broadened its perspective on what constituted a potential threat to our region. Regina Delahunt and Randy Scott presented to Governor Gregoire's Security Committee on the potential impacts from disease outbreak, a mass casualty incident, or terrorist attack. The presentation made clear that the capacity of the health and medical community to manage these threats is a critical component of an effective response. In the months that followed, public health and medical planners worked with their first responder partners to integrate public health and medical incident response objectives into the planning strategy. Events and exercises that occurred to support this effort included the 2008 National Level Exercise, Ardent Century, the Public Health Medical Incident Planning Conference, the Biological Incident Awareness and Response Course, the Cross-Border Planning Conference, and the Cross-Border Health and Medical Screening Exercise. No sooner were the early successes of this effort being realized when a new threat emerged. On Sunday, April 26, 2009, the CDC announced that the H1N1 novel pandemic flu virus was of significant enough concern to order the immediate release of 25% of the strategic national stockpile of antiviral medications to local health jurisdictions throughout the United States.
We became involved on April 26th of 2009, and that was the day that a public health emergency declaration was made by the President and the Strategic National Stockpile was released.
Within hours, Whatcom County had established a unified command structure to respond to this new challenge. The incident commanders included Bill Boyd, Chief of the City of Bellingham's Fire Department, Regina Delahunt, Director, Whatcom County Health Department, and Mark Pearson, Vice President, Quality and Clinical Information, Peace Health St. Joseph Medical Center. Much of the early work focused on the potential need for providing care to large numbers of ill people, far more than might be accommodated by the county's only hospital, which normally operates near capacity.
An interesting thing about it compared to all the other scenarios we had planned for is because it's an infectious disease that covered the globe, to the extent that it got really bad, there was going to be no resources anywhere else.
Under unified command, Whatcom County, Peace Health, and the City of Bellingham were able to establish a community call center to triage the concerns of citizens, plan for an alternative care center, and establish mass immunization clinics in the midst of the pandemic flu outbreak. The partners that conducted this work achieved an unprecedented level of preparedness, rendering the community better equipped for any future potential incident. The 2010 Olympic planning efforts were expanded to include the H1N1 virus challenge. Significant resources were dedicated towards developing plans for an alternate care facility, as well as the framework for a Whatcom County disaster medical system, both of which were components of the existing Olympic Games response strategy. Peace Health St. Joseph Medical Center had already taken several steps in collaboration with public health partners to ensure their preparedness for any event, including partnering with the Washington State Air and Army National Guard as part of a joint training exercise called Olympic Torch. This exercise tested the medical center's capacity to integrate military medical responders into their system. This was accomplished by simulating a formal request for assistance and rapidly onboarding over 40 National Guard personnel of all disciplines into the health and medical community. Once the Olympic Games began, the public health and medical community were fully engaged in the Olympic Committee and Washington State Department of Health daily briefings. These briefings provided real-time situational awareness both in British Columbia and in Washington State. When the 2010 Olympic Security Committee began its work, it was immediately recognized that a centralized facility from which to monitor and coordinate information or resources was needed. Key requirements included proximity to the border and a space physically large enough to accommodate representatives from over 40 organizations and agencies. The result was the development of the 2010 Olympic Coordination Center, or OCC. Strategically located, the OCC is a discreet, secure facility just a few miles from the heart of Bellingham and just 50 miles south of Vancouver, British Columbia. The OCC is equipped with the necessary technology to allow a large group of responders to collaborate during any response scenario. This allows interagency communication to occur that otherwise would not be possible. Having demonstrated its value during the Olympic Games, the long-term goal is to sustain this valuable facility as a resource to local, regional, state, and federal partners.
There will be a brick-and-mortar building that captures all the relationships and lessons that came from working together, and it stays here after the Games because there is no facility like this in this part of the country. The worst criticism we could take from this is we were overly prepared. I'll take that criticism all day.
The combination of 2010 Olympic planning and the response to H1N1 provided the opportunity to demonstrate the value of multi-agency collaboration. Unified command, the management of critical resources, the utilization of response facilities, and the integration of National Guard personnel into the medical center. These were enormous achievements realized by our community. Whatcom County has become a model for multi-agency collaboration across the country, and we will continue to develop and improve our response capabilities. But readiness does not sustain itself without continued commitment, nor can it continue without support at the state and federal levels that have declared emergency preparedness to be a critical national priority.
If we had had the coordination center up and running when H1N1 first emerged, it would have helped us tremendously. We were trying our best to communicate regularly and to make sure that everyone was informed, but we were never all in one place at the same time.
Our hope on a local and regional basis is this facility stays in place well after the Olympics and becomes a legacy facility to allow intelligence coordination, emergency response coordination, and really enhances long-term our ability to effectively respond to whatever the crisis might be.